Imagine the only place in the world you were allowed to play basketball was a massive billion-dollar professional stadium. No driveways, no local parks, and no school gyms. It would be a total failure. You'd have to travel for hours just to shoot around. The lines would stretch for miles, and the court would be so crowded with millions of people that no one could actually play. Real sports solve this by building a ladder. You start with a hoop in your driveway, move up to the school gym, and save the massive city stadiums go to pros. Every country's health system uses this exact same tiered logic. We build local layers so that big hospitals don't crash from overcrowding every time someone needs a basic checkup. So if the giant city hospitals are the pro stadiums, who makes up the local neighborhood team keeping everyone healthy? This foundation is called primary healthcare, and it functions directly in the villages and neighborhoods where people actually live. The neighborhood coach here is often a worker called an ASHA, an accredited social health activist. She isn't a surgeon, she's a trained, trusted local chosen directly from the community. At this level, healthcare happens outside hospital walls. It's about meeting people where they are, right in a village square or a neighbor's yard. Their playbook focuses on prevention. She monitors nutrition, distributes essential vitamins, and teaches basic hygiene to keep the community from getting sick in the first place. This close contact care is vital for the most vulnerable, like checking on a newborn baby or making sure a mother has necessary supplies. By handling these minor issues and educating neighbors every day, these workers stop treatable problems from becoming stadium-sized medical emergencies. Sometimes a person's needs grow beyond the scope of neighborhood advice or basic vitamins. That's when they visit a primary health center, or PHC. Think of this as the school gym of the system, a dedicated clinic designed to handle everyday illnesses for a larger group of surrounding villages. These centers are modest and accessible. They are built at a human scale, acting as a bridge between the small village and the giant city. This tiered structure covers massive populations efficiently. A village worker looks after 1,000 people, while the primary health center handles up to 30,000. Every PHC is led by a medical officer, the team captain who runs labs and guides lower-level workers. This reveals a vital distinction. Medical care is about physicians fixing a sickness that has already happened, but healthcare promotes and maintains health before it breaks. The goal is to filter out 90% of issues before they ever need a major hospital. Only when a case is truly complex do we reach the secondary and tertiary levels, the big district hospitals that function as the pro stadiums for surgeries and severe trauma. These surgeons can only save lives effectively because local PHCs and ASHA workers keep the waiting rooms clear of minor colds and preventable illnesses. Viewed together, these layers form a single logistical network spanning the entire country. This strategy, called equitable distribution, ensures no matter how remote your village is, you are hardwired into a system that escalates your care to a specialist. This entire web is powered by community participation. It works because local people are trained to be the first line of defense for their own families and neighbors. Ultimately, this system functions as a proactive, interconnected team working to keep you in the game. True health security doesn't start in an operating room. It starts right at your front door with your local neighborhood team.